Thank you very much. You're welcome. This is Newsfile. It's your most authoritative news analysis platform. Now we can get to Professor Bokpin. Prof. Bokpin, thank you very much for your patience on the line, Skype. Okay, so we'll get Professor Bokpin back to look at the mitigating financial measures that government has taken, whether they are far-reaching enough or sufficient or inadequate or whatever it is. Of course, we are in a time that all of us must learn to be cooperative and to sacrifice for both individual and the collective good. Right. So let me come back to Dr. Justice Yankson. Do you see clearly that there are difficulties that will be encountered in enforcing these measures?
Well, truth be told, we may encounter some difficulties. I'm using the word may because a lot will depend on how the citizens themselves comport themselves, how they comply to these measures. But at all times, one thing I want people to bear in mind is that this is for our common good. It is a sacrifice we are making for our own selves. Look, if you want to see how bad the situation is, just watch CNN for an hour and see the way and manner COVID-19 is devastating the very solid structures that we find elsewhere. So in the United States, you can talk about New York. I mean, New York is a big state, it's a huge state, not in terms of the land size, but in terms of what it represents as far as the world and America is concerned. New Jersey is equally, solid, and all of them are basically being destroyed in the process. If you go to Europe, Italy, Spain, you just cannot imagine. So people should understand that, one, we have difficulties in our health system itself. And if we don't allow ourselves to be part of these preventive measures such that in the process we all stay safe, if the reverse should happen, i.e. we disobey what is happening, we all get ourselves infected. Look, the health system cannot handle, it cannot cope, will be overwhelmed, and a lot more lives will be lost like we are seeing elsewhere.
The best of health systems are already stretched. They can't handle this situation. I can't imagine Ghana getting into that situation. And I say, God forbid, else we will be overwhelmed and will be damned. Professor Bokpin, looking at the financial mitigating, steps, measures that the government is rolling out, what do you say?
Good morning, and good morning to our cherished viewers all over the world.
Thank you once again for your patience.
This is a little bit too much for us as a country, from the financial point of view. Just barely 2 months into the implementation of the 2020 budget, the assumptions are no longer valid. And it's just because of one virus, coronavirus. So it's as simple as that. In these times, regardless of whatever stimulus package, whatever monetary policy intervention, all over the world, they are not being considered as enough. And for that matter, what Ghana just announced really cannot be said to be enough. But for us, perhaps, we can't give what we don't have. In fact, even before this virus, we didn't even have the physical space as a country. And let me say that we were just lucky. Maybe, or the Ministry of Finance and Bank of Ghana got it precisely right. The manner and the time within which they did the Eurobond. If they had waited a few weeks, it would have been something else, because practically the market is shut. It's as simple as that. But thankfully, we locked in the $3 billion. So when you look at the interventions that have come, I'm not too sure at this stage we can call it a stimulus because it's very, very small and small to maybe our space and the struggle that we have and all of that. I believe that the full determination is going to come out when the Minister of Finance is done with the coronavirus alleviation program.
Right.
Then we'll get to see the details of what government intends to do. But baseline, what perhaps we can work with now, I don't know when it's going to be available actually, is the 1 billion cedis government has announced. And my hope and my prayer is that we will prioritize households and individuals who are more vulnerable, the KIAs and all those who are more vulnerable with practically no shock absorbers. Industries are complaining, but perhaps they may have
doesn't it
shock
appear
absorbers.
to you that for the very, very vulnerable, as you refer to, it is rather the fund that is intended to take care of them? You remember the president announced a fund to which the former Chief Justice, Sophia Akufu, will head, and then he committed the next 3 months of his salary as seed capital in that fund. Do you think that, do you not understand that that is rather the fund that is supposed to cater for, you know, the vulnerable, and then the money, 1 billion, is supposed to go for small businesses and so on?
Look, when you do a lockdown, that takes immediate effect, or more or less from Monday. Who are more exposed in this instance? Whose economic flow or activities will be disrupted the more? I think they are the vulnerable. They are the vulnerable. So I understand the perspective you are coming from, but I believe that we need to do something that gives greater hope to the vulnerable, because in these times they are more exposed. They have no shock absorbers, and that is where compliance may be difficult, and enforcement of the directive may be a bit problematic, because it doesn't have to get to the point where somebody would then come to the conclusion that when I stay in my room, I'm going to die. When I go out, I'm going to die. They are certainly going to make a decision. And all of that. So I understand the difficulties that we find ourselves in. I mean, the US just did a $2 trillion. That's several times Ghana's GDP. And even that one, it's not considered enough.
All right. So in fact, the president said he has established a COVID-19 fund to be managed by an independent board of trustees and chaired by former Chief Justice Sophia Akufu, to receive contributions and donations from the public to assist in the welfare of the needy and the vulnerable. So it may appear that part of the 1 billion may be available for the vulnerable as well, correct?
Yes. Yeah, that is why I'm saying that let's prioritize the vulnerable, the extremely vulnerable. Because the point is, when you are making an appeal, you don't have control over that. But what government promises will be based on some analysis that it can be available. And that is what we should focus on, how individuals are going to respond to that appeal and how that fund is going to be administered with a kind of informal sector, lack of data and all of that. I believe that I don't have control over that. But what is coming from the fiscal perspective in terms of the stimulus, my considered view is that let's prioritize the extremely vulnerable. Because the point is that they have practically no shock absorbers. They have no buffers.
Yeah.
And I believe that something, you might have been getting a WhatsApp from friends, your baba and all of that, about some kind of fiscal stimulus for them to even stock for a day or two or so.
You're right,
that
exactly
is how
right.
challenging it is for those people. And I'm sure you've done your own personal
That's
stimulus
right.
to friends and families and all of that. Okay, so we all have a role to play, and I agree. And I joined the call in Ghanaians, high net worth individuals, the well-to-do, to reach out, extend a hand of fellowship to the less fortunate, to the more vulnerable, the socially excluded, the marginalized, and all of that. So we can only go far when we are together. And
what do you say about the extension of the tax filing dates from April to June, and then 2% reduction of interest rates? by the banks effective 1st April. The granting by the banks of 6-month moratorium of principal repayments to entities in the airline and hospitality industries. And he specified hotels, restaurants, car rentals, food vendors, taxis, and Uber operations. Then said all other sector credit exposures will be reviewed on a case-by-case basis.
Yeah, thank you very much, Samson. I think that is good news largely, and it is not out of proportion to ask for more in terms of also mortgage payments and all of that. So they are very, very important. But there are some of the reliefs that would have to be accommodated through business activities, that you get those reliefs if you are doing business, and then the postponement of the filing of the returns and all of that. These are good gestures. What that also means from the fiscal side is that it's going to have implication for government revenue envelope in terms of the projections that have been made. But of course, I'm sure it is common knowledge now.
Should it be a postponement? Should it be a postponement of filing of the tax, or
extension?
It should be a postponement, as in extension of the period, or it should be a waiver, a freeze?
Well, I think that the government finds itself in a difficult situation because they don't want to open the cap on borrowing that much. So when you do some gestures along the lines that would impact negatively your revenue envelope, then it's going to have implication for the stimulus that you want to be able to dish out there. Then if you don't take care, then it will result in a lot of borrowing. And I believe that has to be managed carefully. But the reality on the ground is that as gradually economic activities are coming to a halt, practically VAT issues do not matter that much, because they are akin to flow of activities in the economy.
So because I'm asking, because elsewhere, and I'm not saying our economy is comparable to what example I want to give, but of course, I go to Kenya. In Kenya, Kenyatta announced 100% tax relief for workers. Why can't we do that? In fact, elsewhere, salaries are going to be paid whilst you are home. Clear steps known.
Yes, I agree with you. Like the US and UK.
Yes.
So once you do a total lockdown and businesses no longer, in other words, you are truncating the going concern of businesses. And nobody is handsome or beautiful enough to maintain a presence on a payroll if you can't justify that by the flow of cash. Then in that case, the government must come in and support the payroll. So in some countries, they are covering the payroll to about 80% or so, and then in the US and all of that. In fact, the numbers have increased since recording started in the US,
right,
in terms of number of Americans who are making claims for unemployment interventions.
They are running in the 2 million, 3 million or so far.
Pardon?
About 3 million so far.
Of what?
Unemployed.
Yes, in the US. And the question is, do we even have the data for Ghana? If we want to support them in terms of the informal sector, right, and all of that. Apart from that, once you are imposing restrictions, essentially, you are interfering in the business model that companies use. Is going to have implication for their projections for the year. But I also do understand that these are unusual times. These are extraordinary times. So nobody can come out of it as a winner necessarily when we measure performance in terms of profit. So we all have to take a haircut in one way or the other. We all have to make some adjustments.
Okay.
We all have to make some trade-offs. And I would appeal to Ghanaians that when you do policy prescriptions, it's based on assumptions. One of them is that every Ghanaian would respond positively to all the measures that have been announced.
Okay.
Because when it comes to healthcare, when it comes to security and all of that, a lot depends on us as individuals.
Right.
Putting our health ahead of perhaps everything else.
Exactly, and the president said that. The president said that. He said, "We know what to do to bring back our economy back to life. What we do not know is how to do is to bring people back to life. We know how to bring our economy back to life. What we do not know how to do is to bring people back to life." Does that suggest to you also that the president is ready to open the chest and spend as much because we can bring the economy back when it's in a sleep mode now? We can bring it back, but we can't bring life back. So he's ready to spend so much.
That assurance is very good. Certainly, we cannot be talking about debt to GDP ratio around this time. And then the normal conditions under the Fiscal Responsibility Act, in other words, the threshold of 5%, certainly not.
All right.
These are unusual times, and therefore it calls for unusual physical measures.
All right.
It's going to be painful. The real effect of that will be seen perhaps post-COVID-19,
All right.
when we begin to count the cost and how the economy is going to absorb all of that. But right now, because we are in a crisis situation, we want to focus our attention, physical, monetary, health, the various cross-sectorial issues to getting out of this. And then the easiest thing to talk about in terms of restarting will be the economy. Once you die, resurrection lies only in the Bible. It doesn't lie with the president. And that is why individuals must take health seriously. I mean, look, the effectiveness of the lockdown, whether we do a total lockdown or the partial or the variation that we are doing, depends on you and I. It depends on ordinary Ghanaians. It's very, very critical.
Okay. Thank you very much, Professor Bokwing of the University of Ghana, helping us to understand the money aspects of this relief that the president, gave. This program, as always, is brought to you by MTN Everywhere You Go, Bank of Africa, strong as a group and close as a partner. Amen Scientific, God is a healer. Duraplus, where Duraplus goes, water flows. Coa FS, that's your immune booster. You need that now than ever. Waylead, we build homes for you. And Joy Learning, keep learning. So in the midst of the tragedy, you can continue to learn. In the midst of this disaster, you can continue to learn. All you need is your Joy Learning, and by that you need a digibox. Get that fixed, and then your children who are at home will begin to do things. Of course, it's been about 2 weeks of having the kids at home, and you can imagine that it's not easy. Right. So you're welcome back. This is Newsfile, it's your most authoritative news analysis platform. And here on Newsfile, we always put Ghana first. So let's begin to get towards wrapping up our discussion. And my guest in the studio still, Dr. Justice Yangson, General Secretary, Ghana Medical Association. He's also a lawyer. And Kesley Atu Coleman is Complex Emergencies Expert and the Fellow of Imani Africa. Okay, so gentlemen, what are your areas of concentration that you want to bring attention to? First, in cooperatively helping to educate the people, or bring policymakers' attention to ensure that everything goes smoothly?
Thank you, Samson. I think the first thing is I have some concern with the way we are using the concepts of the lockdown. We are mixing up issues and it's affecting the communication.
Explain.
Yeah. So a lockdown has several aspects. If you have a curfew, it's a lockdown. If you have internet shutdown, it's a lockdown. If you close your borders, it's a lockdown. If you have a stay-at-home measure, it's a lockdown. These 2 weeks is a stay-at-home, you know. And so it's very important for us to be very clear about that. Now, a stay-at-home measure is to give the responders or the people providing leadership for the response time to gather data and then also strengthen the strategy. So we are looking at a situation where the president is saying that anybody who came into the country from 3rd March to when the deadline to close the borders was announced is going to be what? Tested. We are estimating that to be like 50 to 70,000 people. And if you look at the data of the number of imported cases that have come in and the rate of infection of those who came in, that is a very significant number. So I think that is the reason why it's important for Ghanaians to support the government during these times. Okay, we are looking at a disease that poses an existential threat to this country. So it's not a joke.
Yeah.
So that is very important.
I was a little surprised though that the Ghana Health Service Director said it's not a killer disease.
It is. That is why this disease has killed more people than Ebola. And Ebola was even fatal in terms of survival rates. But this has killed more than it. So if people are saying that, oh, you know, COVID-19, it's not serious like Ebola, they should be careful. If we are looking at possibly 50 to 70,000 people who are in the system right now, who we are now going to look out for to test, it's possible that there are a lot of risks that we are facing, number one. Number two, the bit about the omission of journalists, for me, was a big concern. That's why I'm happy that I think efforts are being made to correct that, you know, because this is a war situation, so you can have omissions. So it's fine to correct it. But this is very important because when you are managing a complex response like this, you need to be guided by the humanitarian standards. And the humanitarian standards lay out some key principles. First one is do no harm. Second one is show people dignity. Third one is give them, they have the right to assistance. The fourth one is you have to respect their tradition, their customs, and then their culture. And then you also have to be impartial. So what we are saying is that for me, for the next 2 weeks, the journalists and civil society organizations and Ghanaians in general should hold government to account in terms of the extent to which these principles are respected during the next 2 weeks. It's very important. So that's why I'm encouraging all journalists to read the 2018 core humanitarian standards, and which is the basis for the WHO guidelines on how to manage the response. Very important. The third bit is the management of the response. Okay? If you look at the president's speech, all his speeches, he gives a broad overview of the outcomes he's looking at. He says he wants to limit and stop the importation of COVID-19. He wants to contain the spread. He wants to ensure adequate care for sick people. He wants to limit the impact on the economy. That's why the discussion with Professor Bopin was very interesting, and all the packages that are being put in place to target pro-poor interventions, and then inspire the expansion of the domestic capacity and deepen self-reliance. For me, the last part shows that the president is thinking of resilience. When you are faced with an adversity, you need to build capacities to cope with that adversity and bounce back. That is why those measures are very important. Now, so it means going forward, the management of the response has to be very important. Now, what are some of the key things that should guide us as we hold government to account? Number one, the response and the strategy during the next 2 weeks has to be driven by core values of respect and dignity, number one. Number two, the organizational model, how you manage technical experts, those in operations, those in logistics, the epidemiologists, the laboratories, those in transport. You are bringing together so many expertise, but you need to be able to manage them. You need to define decision space. You need to define decision mandate, and there should be clarity on reporting line so that you minimize duplication of efforts. Because one of the things I've seen is that coordination can be an issue. You have people mean well, they want to support the government, but you need to coordinate all these resources. Because during emergency situations, there are also risks of so many exposure to fraud. That is why, and corruption and abuse of human rights. So these are some of the things that has to be taken into account. The last bit is the human resource aspect, the focus on health workers. We need to have incentives for them during these times, when they are very much exposed. We need to invest in the capabilities for testing, capabilities for the wherewithal, and also even giving them continuous training. as they go about this response. So I think these are some of the areas that government should be able to.
All right, thank you very much. So, Dr. Yancey, when you were asking for this lockdown, according to my dictionary, is simply a state of isolation or restricted access instituted as a security measure. So whatever grade you have it, this is a lockdown. No. Were you looking for 2 weeks? Of course, it's subject to review, but the practice so far has been to look at least a month or 2. Why are we looking at 2 weeks?
Well, it's something that is also a bit dependent on what you have in the system. You know, it looks like for now we've all come to accept that the incubation period for the virus is about 2 weeks. Of course, the studies seem to be pointing to something slightly more. And throughout the activity, the president has been using this 2 weeks approach. So when we called for the lockdown, we knew that as much as possible, the president will limit it to some 2 weeks and then review as we move along. For me, whether it was 2 weeks or a month, we shouldn't be so worried about it. Once we have a window for that review to happen, in fact, the review can even happen next week if the president thinks that what is happening now is not good enough or we are not cooperating enough, he can decide to add on to. So as of now, I think the focus should be what is the essence of the lockdown. It's to achieve one particular aim, to break the chain of transmission. And by that, all we are saying is that to one, ensure that people do not get new infections in our society. Of course, just like the president said, the other bits around is that it gives us room to do our contact tracing properly and ensure that at least we've also picked up all potential contacts, all potential suspected cases, test them properly to be sure that we do not have a lot more of the problems in our community. What we all don't want now, which is why we also ask for the lockdown, is that the community spread is what is going to be our bane. So now that we have the imported cases being in the majority, i.e. about 97%, the 3%, we need to ensure that we don't escalate that percentage in exponential figures that will lead us to the path of destruction. Now, we also accept that from the results of the quarantine bits that happened, the mandatory quarantine, where the first set of 185 people who were tested, we had 25 positives. What it told all of us on the health front is that the days preceding the lockdown of the airports, the borders, that 2-day mandatory period, what we picked, clearly the days preceding those days, most likely people had filtered into the community. So we went on that presumptive position that the disease is already in our community and we needed to tackle the disease head on. So at this point where we find ourselves in this lockdown, what I want people to understand is that it is not a comfortable situation. We ourselves, as we stated in our release that there's going to be discomfort and what have you, but it is for our common good, as I said earlier. 2, people should also not forget about the preventive measures. You may be locked down at home, but because we are mindful of potential community spread, as much as possible, especially for those who live in compound houses and what have you, we should try and still practice that social distancing that we've been talking about. It is very important. And then, of course, the frequent washing of hands, the use of sanitizers and what have you. We should be able to do all of them. And then for the health force, unfortunately, it looks like your name was not really mentioned in the list of exemptions. And I think we need to cure this. If you look at the Act itself, the IRA, the Imposition of Restrictions Act 1012, you need, it's clearly defined in there that we are essential services.
Okay.
But because the president went on to mention, we expect that in the EI, if it was an omission,
then health service also be okay.
Because we need that freedom to be able to move around and work properly.
Thank you also very much. We run out of time, and we're continuing the programming. You are going to see footages of people who are rushing. There's a mad rush for goods and services as the lockdown, begins. And so here on Joy News, on Midday News, we are bringing you what is happening. You drive through gas filling stations and you see they are not even practicing the social distancing as the queues begin to pile up. It's not the best. Thank you very much, Justice Yankson and Atu Coleman. I am Samson Ladi Ayanini. This has been Newsfile. We come your way again next week, God willing. Let's pray that we all practice the safety precautions so that we'll be alive to tell the story of how things went. My outfit, as always, is by Letida.